I'm Amber Fenton. I'm at Dell Children's Eye Center in Austin, Texas, and I finished my fellowship at IU in 2012. I really just wanted to give you guys an understanding of why I chose IU over some of the other fellowship programs. The number one reason is the people. Everyone is so approachable, so open, so knowledgeable that you just feel so included and that there's never a dumb question. Obviously the education is top notch. They do everything there. So they do all of their own plastics, the hemangioma surgeries, the levator lifts, the levator slings, the entropions. They do all of their own glaucoma, the 360 trabs. I mean, anything intraocular you can think of. They do their own retinoblastoma, and now they have intraarterial in the hospital. So they have case conferences every month with the hemonc and the IR and ophthalmology. So that's a great learning experience. You're gonna get a ton of adult strabismus, thyroid, anything you can imagine, you're gonna get related to pediatric ophthalmology, and the surgical volume you're gonna get is through the roof. There's no other fellows in the subspecialties that are taking any of your cases, so it's all you and the other fellow, and there's typically multiple people operating every single day, so you can kind of cherry pick what you wanna do and where you wanna be. The availability is great just because every Monday you have kind of case conferences where you're meeting with the attendings and you can ask all the questions from the stuff that you didn't see the outcome from a surgery because you were in clinic, or you had a question about a patient in clinic and you didn't get a chance to ask because you guys were so busy. There's the time every single week to go through and just get your learning solidified in your brain and just rethink about everything. You also have a lot of autonomy in your own fellowship clinic. So you work with the residents, and so you get that teaching experience to the residents as well, but also you get that feeling that this is what it's gonna be like next year when I'm all on my own, that there's always someone to ask, and you're running your own practice. The other benefit, since I went into private practice after fellowship, was that they have Midwest Eye. So it's almost like its own private pediatric ophthalmology clinic that's separate from Riley Children's. So there I learned how to run a pediatric ophthalmology practice that was separate from an academic practice. So you get the best of both worlds in learning to bill and kind of the economics of it. So I really thought that was beneficial. The IU family, everyone's awesome. So everyone's always available. There's someone in every part of the United States that finished from IU, and so getting a job afterwards is awesome just because everyone knows everyone. It's also every year we have a meeting and we get to see each other and present our hard cases and just have a great meeting and gather back of just being with like-minded people to remind you that you're not alone and that everyone's still learning. So it's just an incredible year. You do a lot. I mean, even ROP, gosh, there was like 15 to 40 babies a week. So you'll get a ton of laser, a ton of injections. I just can't speak highly enough about how confident I felt as a surgeon when I finished fellowship. And everyone's always still available. I still call Dr. Plager and Dr. Hyder and the team just to ask them random questions sometimes, or shoot them emails about measurements and this is what I'm thinking. Is there anything else I should consider, or what would you think? So just having that safety net when you're out of approachable people is incredible. So I can't recommend it highly enough. You'll get a great education wherever you go, and I wish you guys all the best of luck. But really consider IU. It's a wonderful year. And I wouldn't take it back or wouldn't have chose anywhere else now that I'm out. So you guys have a good day, and you can always email me with any questions at Dell Children's Eye Center. I'm always available, but best of luck.